So now we have, c'est Dalila, votre prénom? Dalila, how old are you? 32, young, attractive lady. Can you zoom on her face and maybe show? So we see that the nose is not that big. Can you zoom on the nose? Vous pouvez zoomer, voilà. And the main problem is this nasolabial angle is less than 45 degrees. So we have a choice. Or we inject directly some filler here on the radix of the nose, like XL or L. The thing is, if I do that, caméra 2, le profil, s'il vous plaît, I can get this straight, but still the nose will be drooping and I need more product, so I will end up here. You see, if I take this line, as we mentioned, so this line from here will end up a little bit too high. On the opposite, if I start, reprenez la caméra 1, with the nasal spine injection here, like the Eiffel Tower concept here, what I will obtain, caméra 2 s'il vous plaît, I will obtain something simple that I show to the patient on the mirror. That will be the effect. And you see the tip positioning just by 0.4 or 0.5 ml, I will get this, and then it's easier to smooth and to do the camouflage. And I don't need that much product to inject here. Okay? Alors, camera 1. So that's my idea. And then if it's not 100% perfect, we can also do a little bit of the supratip injection. You see, everything I do is medial. Sorry, that's a little bit too large. Okay. And we'll be very, very... vous pouvez mettre vraiment face, parce que là, on n'est pas tout à fait de face sur la caméra 1. Voilà, perfect. Et zoomer un petit peu plus. Okay, so where are the zones we don't want to go? The facial artery come from the masseter here. In front of the masseter, come from the neck here. This is a facial artery, okay, and it's very sinusoid. This facial artery, just if you can, mordre. If the patient bite, I can feel the masseter, and the facial artery is there, and this is very deep. Si rouillez fort, voilà, stop. Then this, relâchez. On the bone here, on the malar bone, you have the zygomaticus major and zygomaticus minor for the smile. Here the artery is still deep. Here it's under there, it's coming to be a little bit more superficial. And then give a branch to the angular, this is the angular artery. Here you have a branch for the lips. Here we have a branch for the lateral part of the nostril. And here you have a communication with the supratrochlear and the supraorbital. And this one we don't want to go. So this is a no-go zone. Okay? That's why if you stay medial, it's safe. Remind me how much time I have to inject.
You have 20 minutes.
20 minutes. Okay. So that's going to be right.
30 minutes all.
30 all, okay.
Now you have 20.
So we use gloves, of course, to inject. We use antiseptic. We are very calm with the patient and gentle, n'est-ce pas, Dalila? Yeah. Because, of course, you imagine we're going to inject on the skin. It can be a bit painful. So for this demonstration, I use a topical cream. In my office, I never use any topical cream. Okay. And then I use anterior grade technique because I like to injection anterior grade to numb the area. Vous êtes prête? Okay. So last but not least, before I start, caméra 2 s'il vous plaît. Voilà, ça c'est parfait. Absolument parfait. Okay, so that's the nose. You see this is the bone part, which is here. The fixed part of the triangular cartilage, which is here, this part, and then the mobile part, where is the alar cartilage, and that's the alar cartilage. And then the nasal spine is there, so we're gonna inject exactly here on this nasal spine, and then we go up to the columella, from here to here, okay? Alors, let's go. I use another, as I touch the face, I use antiseptic again. Ça va? On y va. Right? And qu'est-ce qu'il y a? Oh, oui, 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 oui. She has to close the eyes, I say, of course. Bon, alors, camera one, maybe. Just to show, and zoom on the camera one, just to show where I put the injection point. So, I pinch the skin. Zoomez un peu plus, s'il vous plaît. OK. On y va? Allez, respirez bien, tranquille. Voilà. OK, down to the ball. On commence à injecter. Tournez un peu la tête vers moi.
You are with XL or double XL?
This is XL with the lidocaine. I can use, of course, the double XL, but I think she doesn't need too much projection.
But in some case, it happens to you to use it.
I use it a lot, double XL. But on that case, because vous avez un peu mal. Hein?
Harvey, didactically, you touch the bone and you move a little bit forward then, or you just stay close to the soup?
When I was starting, I was touching the bone, but it is painful. So now I know I'm deep enough. I feel the resistance.
Okay.
I know I'm deep enough, so I don't touch the bone. Sur une échelle de from 0 to 10 on the scale of pain, how much is the pain? 1? No.
Be sincere.
No. Tell me the truth. So, really? Okay. Tournez un peu la tête là. Voilà. Et centrez l'image. Voilà. You see
Mine normally are crying at this point.
she's crying, but she's because she's very happy. Okay, so now I stop. I look at the profile. You see the profile? You see the projection already? So I change completely her angle. Regardez. Voilà. Vous avez vu? Super. And now, so I use the cap. Fermez vos yeux. Close your eyes. Closez vos yeux. So I bend this needle on the cap, on the sterile cap. I'll take the same entry point, antiseptic, gauze. Voilà. Attendez, donnez-lui une petite compresse sèche. Tenez, essuyez vos yeux. Je ne veux pas vous faire pleurer. Voilà. Okay. So I already use 0.4 ml. En bas. Okay. Nasal spine. And now I go up to the columella like this. Okay. So I go to the same entry point here. Okay. I start to inject immediately. Vous sentez rien. Of course, it's numb. She said, I don't feel anything because it's numb. Okay? Voilà. And I stay very medial. And what I want to see, you to see, maybe camera one, please. And zoom on the camera one. Voilà. Zoom on the camera one. Voilà. What I want you to look is this triangle. And I'm doing voilà, the tip projection. Ça va? Okay. In between those two cartilages, I have nothing dangerous. It's just fibrotic tissue. Okay, I control also on the profile. You see the tip projection and also the triangle. I'm pushing the two alar cartilages. Ça va? Toujours? Okay. Vous sentez plus rien là? Okay. So camera 2. Voilà. Okay. So I'm using, so it was 0.4, and now it's 0.8. So I use 0.4 and 0.4, roughly. Voilà. Camera 1. Voilà. So I didn't change the shape, but this is more delicate. You see the triangle and these two projection. And the nose is more, she has more elegant face, even if you see a little bit the nostril. Okay, camera 2. Voilà, okay. So now we go to the dorsum. Voilà. So I was on the right side, I moved to the left side. Maybe we can stay on camera. Okay, maybe camera 1 just to show you where I put the needle. And then we move to camera 2. Alors, one trick is, you fermez vos yeux, pinch the skin, so to distract the attention from the patient. You go down to the bone. Okay, and now camera 2. Okay, tournez un petit peu. Voilà, normally, of course, I don't turn the head of my patient. Okay, ça va? Okay. So here is 0.2 ml that remain in my syringe. Voilà. There is a little depression here, so I move from there. Ça fait mal. Because I was too fast and I didn't inject. Voilà. Camera 1, I want to see the front view. What is important also is not to over-inject here and not to get the gel falling down here. And you had an injection a year ago or two, and the gel came down here. Okay, so we don't know which gel, but and we don't tell which gel, by the way. Vous pouvez me tenir ça et rester là, s'il vous plaît. So now I do a molding. You see my fingers, I create, camera 1, I create this shape, it's like a rectangle, because I want to shape that. Zoomez un petit peu, s'il vous plaît. Voilà. 2 fingers lateral, 1 medial. It's like a rectangle. And I want to just create this tiny projection here. And now, because this is like a normal life, I don't want to inject 2 or 3 syringes on her nose. I have this 0.1 ml. What do you think? Shall I inject? Attendez. Shall I inject on the supratip or more on the dorsum? Caméra 2, pardon. Je vais tourner la tête comme un malade. I think the nasofrontal angle and the dorsum is smooth enough. Zoomez un petit peu. Voilà, I think she needs a little bit. We like on surgery, we like this, what we call the double break. This is one break and a double break, but I think she needs something here. Regardez, le nez vous plaît ou vous voulez que je corrige un peu ce petit creux-là? Voilà, okay, so I ask the patient. Voilà. Of course, surgeon, we are God, but God listen to à ses ouailles, hein, to the believers. Voilà. So camera 1, just to show. Tournez la tête, excusez-moi, vers là, vers moi. Attends. Okay. And this is 0.1. So here I'm not that deep. I'm subdermal. Voilà. Because she said because I'm more subdermal. I don't need to go too deep there. Voilà. And what is important, you look at the color of the skin, and you look when it's a bit painful. Of course, you have to stop. And the severe pain with bleaching, you stop immediately, and you use hyaluronidase. No choice. You don't think. You just use. I have a hyaluronidase in my office, in the fridge, ready, and mixed. Alors, faites voir le profil là. Okay. So now I do a bit of molding.
Yes, it's great, Hervé. Very
Voilà.
nice.
Okay. So, on the front view.
You have to imagine it. We make this only with one syringe, which is really a case that happens every day in our office. Because, as you say, to do a face with 10 syringe, it's very easy in a workshop,
Yeah,
but
sure.
it doesn't happen at the office.
Or 20 or 25, I will see sometime. Huh?
But at the office, it's not every day, unfortunately.
No. So what this is a trick we use also in surgery. After the rhinoplasty, we use some water, and you see roughly the two aesthetic lines, and that the nose looks straight, okay, and balanced. So we turn, camera 2, okay, voilà. So that's what I will stop there. I will tell her to come in a month. Maybe she need a little bit of more injection here or a little bit of more injection here. Mm-hmm. So this is for a budget of 1 syringe. How much I have? How much time I have?
No, it's
C'est fini?
No, you have 5 minutes more if you want.
5 minutes? Okay.
Harvey, can I make you a question?
Yes,
First of
please.
all, congratulations. Very, very good result. Really, very...
Yep.
Very, very good result. Just to like practical situation. Do you recommend something for the patient after treatment? Yesterday we were telling about, I told you the case I had with the sliding of the product because of G. because of the use of heavy glasses, maybe. And another thing is, how do you behave with patient with a previous rhinoplasty, with the open rhinoplasty that you see like the scar? Even sometimes patient lies, they don't tell us. And do you have do you behave differently in patient with previous rhinoplasty?
Yeah, this is dangerous.
And the other thing is, if you recommend something to do or not to do after a rhino filler.
Okay, so of course, after rhinoplasty, you have to be more careful and super careful. Normally, if you're not the surgeon who did the rhinoplasty, I don't recommend you to inject. Show me the camera too. I just put 0.5 ml more, and you see now I have the perfect result.
Perfect.
Okay, and this is how I do it in my office. It's less than 30 seconds. In front view, camera 1, zooming. Okay, voilà. Bon, the thing is, more you put here, more you have a big tip, so I have to stop now, okay? You see?
It's
And
very nice.
what I like is the triangular here. You have this triangular shape, and again, camera 2. Okay. So question was for the surgery. Yes, that's more dangerous. I would say let's try 0.1, 0.2, but even with 0.1, 0.2, I had some vascular problem on my own case. So I recommend you to use, better not to touch. Of course, people are demanding, okay, I have a little hole here. Can you do something?
Yeah, I don't do, in my practice, I don't do before 1 year. I don't know if you do the same. I don't
this for
correct
sure.
anything. Yeah,
No, but this
1
for
year
sure.
at least.
If it's multi-surgery before, better not to touch. And another thing we don't think about it is people who get a nose job, and then one injection on the nose, a second injection on the nose, and I've got one on my case. I did a correction, a little bit here, and the lady, okay, come. I started with Hydromax, and then she said, oh, I want more, and I use something thicker, and then we get a bit of vascular libido, so I use hyaluronidase, I remove everything. So people now are using a lot on the nose. You have to ask the question, because lips you can see, nose you don't know. And what was the second part of your
So
question?
if you have a special recommendation for rhino filler, because when we operate rhinoplasty, people have a lot of recommendation not to wear glasses, heavy glasses, not to make sport, for example. To improve or to preserve your result, do you give any special recommendation in the post-treatment period or not?
So I just say that they don't have to do sport for 1 day. If they put glasses, try not to put it on the radix. Of course, it make camera 2. If you put the glasses here, of course, can make a mark. And you have very big glasses. Sometimes it make a mark, so they have some time to change. So what I use XL 1.2 ml. I put just 0.2, not 0.5 here at the touch-up. Okay. So I don't want to take time for marching. Maybe we stop there. I can get some question. Thank you.